Tuberculosis is the world's top infectious killer, although new pandemics have risen as threats to humanity. India accounts for a quarter of the 10 million cases occurring globally. TB disproportionately affects poor and vulnerable communities in society and has devastating effects on their physical and socio-economic conditions. The call to eliminate TB is global, and the Government of India has committed to end TB in the country by 2025. The Tuberculosis Health Action Learning Initiative, known as THALI, was a 4-year project funded by the United States Agency for International Development, USAID, with the aim of improving access to services and treatment outcomes in urban settings in collaboration with the government. This patient-centered initiative was implemented by KHPT and World Health Partners, along with TB Alert India, Child in Need Institute and JSI India in 9 states, covering a population of about 115 million. THALI focused on developing innovative, evidence-based models aligned with India's National Strategic Plan. These innovations aimed at strengthening the National Tuberculosis Elimination Program by providing care and support solutions to high-risk patients and tapping into the potential of the community to sustain TB control. THALI's interventions were designed to cater to patients at every stage of the continuum of care, from health seeking to diagnosis, treatment initiation and treatment completion. While TB is curable, barriers such as the treatment's duration and side effects are often compounded by the stigma from the society, hindering treatment completion. THALI's approaches were aimed to help patients complete treatment and create an enabling environment within the communities and facilities. Community engagement was a key component of THALI's interventions. In Jharkhand, World Health Partners sensitized over 20,300 workers and their families in 4 blocks of the coal mining belt, where their exposure to hazardous airborne particles makes them vulnerable to developing TB. Field officers identified 423 presumptive cases and referred them for diagnosis. 13% of them tested positive.
और इसके लिए पुनरीक्षित राष्ट्रीय यक्ष्मा नियंत्रण कार्यक्रम चलाया जा रहा है, जिसमें वर्ल्ड हेल्थ पार्टनर की तरफ से पिछले साल से सहयोग प्रदान किया जा रहा है और इनके द्वारा सहयोग राज्य के 3 जिलों रांची, धनबाद और ईस्ट सिंहभूम में दिया जा रहा है और इस सहयोग के अंतर्गत एक पेशेंट सपोर्ट सिस्टम इनके द्वारा दिया गया है.
THALI also screened factory workers in Punjab facing occupational hazards at their workplace. About 13,500 factory workers were screened at camps organized in over 307 factories. About 1,170 workers were found to be presumptive cases, and 157 of them were diagnosed with TB. In West Bengal, World Health Partners engaged with local community-based organizations working for key affected populations and built a cadre of frontline workers known as touch agents from the target communities. This cadre conducted over 15,800 household visits for high-risk populations, including commercial sex workers, LGBTQ persons and persons living with HIV, while also increasing community awareness.
I must congratulate THALI for their tremendous work they are doing with us, and this work should continue from RNTCP perspective, in patient finding perspective, treatment of the tuberculosis patient in those CSWs and high risk cases, and I wish them good luck for future.
THALI's community engagement component focused on enhancing TB case detection, promoting the right messaging around TB and mitigating stigma. Frontline staff in Karnataka Telangana and Andhra Pradesh identified community structures such as self-help groups and labor associations and worked with them to integrate community health and TB activities into their welfare mandate. About 395 community structures are now raising awareness, referring persons for testing, organizing health camps, mobilizing support for TB patients, and linking them to welfare schemes. They have referred over 2,800 persons in their areas for TB testing, of which 2,730 were tested and 247 detected with TB.
బోడబండ సైడ్ 3లో నేను బిజినెస్ చేస్తున్నా. టీ స్టాల్, జ్యూస్ స్టాల్ ఈ 2 బిజినెస్లు చేస్తున్నాను. ఈ జ్యూస్ స్టాల్, టీ స్టాల్ దగ్గర వచ్చే జనాలందరికీ కూడా మొబిలైజ్ చేస్తూ వాళ్ళకి చెప్తూ వాళ్ళ యొక్క డీటెయిల్స్ తీసుకొని నేను రిజిస్టర్ మెయింటైన్ చేస్తూ ఏమైనా ఒకవేళ ఉన్నట్లయితే నేను పంపించడానికి నాకు మంచి అవకాశాన్ని ఇచ్చారు. ఈ తాలి ప్రాజెక్టుకు కూడా నేను చాలా కృతజ్ఞుడై ఉన్నాను. కాబట్టి ఇది చేయడం వల్ల కూడా నాకు సంతోషంగా ఉంది.
KHPT and TB Alert India established patient support groups in health facilities which served as a safe space for patients and caregivers to discuss sensitive issues such as stigma and disclosure. These meetings allowed regular interactions between the patients and healthcare providers, promoting patient-friendly facilities. THALI also capacitated 140 patients as TB champions to motivate other patients on their treatment journey and advocate for TB patients with the state. Patient care and support was the second linchpin of THALI's interventions. World Health Partners conducted a mental health assessment for 5,300 patients in Gujarat and linked almost a third of them with moderate to severe depression to therapy and psychiatric care services. Through extensive field activities and data analysis, KHPT identified 6 categories of high-risk patients prone to unsuccessful treatment outcomes. KHPT formulated the differentiated care model, which provided tailored care and support services to TB patients in Karnataka, Telangana and Andhra Pradesh based on a risk and needs assessment carried out by the frontline workers. The model was adopted by the state government and almost 14,500 patients received personalized care according to their risk profile, which included counseling and linkages to welfare schemes. THALI is proud to have reached a population of over 5.3 million, identifying over 7,800 patients and following up with almost 60,000 patients to provide care and support services across 39 districts in 9 states. THALI's interventions, led by a diverse team of frontline workers and program officials, generated a rich set of learnings which can feed into the strategies for TB control at the national level and complement existing efforts of the government as we move towards achieving India's goal of TB elimination.
ಈ ಒಂದು ವಿಚಾರದಲ್ಲಿ TBಯನ್ನು ತಡೆಗಟ್ಟುವ ನಿಟ್ಟಿನಲ್ಲಿ ಒಂದು ವಿಚಾರ ಹೇಳಲಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತಾರೆ. ನಾವೆಲ್ಲರೂ ಕೆಲಸ ಮಾಡ್ತಾರೆ. ಇನ್ನೂ ಸ್ವಲ್ಪ ಹೆಚ್ಚು ನಮ್ಮ ಮನಸ್ಸಿಗೆ, ಆತ್ಮಸಾಕ್ಷಿಗೆ ಅನುಗುಣವಾಗಿ ಪ್ರಾಮಾಣಿಕವಾಗಿ ಇನ್ನೂ ಹೆಚ್ಚು ನಾವು ಕೆಲಸ ಮಾಡ್ತಾ ಹೋದಷ್ಟು ಹೆಚ್ಚು ಜನರು ರೀಚ್ ಆಗ್ತೀವಿ. ಸೊ ಈ ನಿಟ್ಟಿನಲ್ಲಿ ಎಲ್ಲರೂ ಕೈ ಜೋಡಿಸ್ಬೇಕು. ಎಲ್ಲರೂ ಈ ಒಂದು ನಮ್ಮ ಸಿಬ್ಬಂದಿ ವರ್ಗದವರಾಯಿತು, ನಮ್ಮ ಸಂಸ್ಥೆಯವರು ಹಾಗೂ ಸರ್ಕಾರೇತರ ಇನ್ನಿತರ ಸಂಸ್ಥೆಗಳು ಎಲ್ಲರೂ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಕೈ ಜೋಡಿಸಿ ಬೆನ್ನು ತಟ್ಟೋದ್ರ ಜೊತೆಗೇನೆ ಸೊ ಎಲ್ಲರೂ ಹೆಚ್ಚು ಕೆಲಸ ಮಾಡಿದ್ರೆ ಈ ಒಂದು ಕಾಯಿಲೆನ ತಡೆಗಟ್ಟಬಹುದು.